Thank you, Yuna.
Happy ninth day of the new year, everyone. I'm Yuna Lee Ghost, AD41 ADAM delegate, and welcome to today's Healthcare Town Hall on the urgent healthcare crisis. We're excited to see everyone show up today to help us fight for Medicare for All in California. And before I continue, this event will be recorded. So if you do not wish to be recorded, please turn off your video. And another thing is, if you're not speaking, if you could please mute your microphone, that would be helpful. So this will be a great time of coming together with fellow community members to discuss how we can bring Medicare for All to Californians. And we'll start off with Dr. Pa Song of the Physicians for a National Health Program, who will welcome folks to the event. Then there will be opportunity to share testimony and strategies for achieving single-payer healthcare in California. And in addition to Dr. Song, featured speakers include Dr. Bill Honigman, also with the Physicians for National Health Program, Gina Harris, nurse for Medicare for All, Erica Ferriston, Healthcare for All LA chapter, Jenny Chang with Healthcare Now, and Jacinta Link, also a nurse for Medicare for All. And we're thankful that today's event is sponsored by a number of progressive slates of ADAM candidates throughout SoCal. In various districts across California, Medicare for All single-payer champions are stepping up to run as ADAM candidates as part of a progressive slate of candidates. They include the following slate co-sponsors of today's event: AD41 People's Action Slate and in the San Gabriel Valley Foothill communities, AD45 People's Action Slate in San Fernando Valley, AD51 People's Action Slate in Northeast LA, AD57 Democrats for Justice in Whittier, AD53 the People's Slate in downtown LA, AD64 the People's Voice Slate in Carson, Compton, and Wilmington, AD50 Progressive Slate in Malibu, Santa Monica, Beverly Hills, AD48 Challenging Establishment Slate in Baldwin Park, Covina, and others that are here with us. So as you can see, there's a lot of slates out there. So that's great. If you live in any of the mentioned districts, these ADAM candidates are running to represent your interests. So make sure you go to adamelections.com to request your ballot now before the Monday, January 11th deadline. We're also thankful that today's event is co-sponsored by the Progressive Asian Network for Action, an independent grassroots all-volunteer group that mobilizes Asian Pacific Islanders and allies to advance the interests of 99%. And also co-sponsored by the Future Left, a collective in the intersection of politics, art, and theory, seeking to foster radical change in contemporary culture, and also co-sponsored by Medicare for All advocates Kenneth Mejia and Jenny Chang. And as Reverend Dr. Martin Luther King Jr. says, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. Never has this been made so clear in modern times as in our current pandemic, with millions being thrown into unemployment and uninsurance. So thank you so much for being with us today. Let's put our minds together and see what life we can make for our families and communities. And we're fortunate to have Dr. Pa Song open our time together. Dr. Song is a radiation oncologist, co-chair of the Campaign for Healthy California, and board member of Physicians for a National Health Program California, Healthcare Now, People for the American Way, Progressive Democrats of America. He's also on staff at Dignity California Hospital, where he sees primarily Medicaid and uninsured patients. So thank you so much for joining us, Dr. Song.
Thanks. Thank you so much. And wow, it's amazing to see all of you on this call. What a great family of activists and people that have been fighting for all the right causes, not just Medicare for All. And I'm just honored to be able to be here with you. What I was asked to do was sort of set the tone for today's event and to really allow some of our amazing speakers to share more about the work that they're doing to really win Medicare for All in our state. But before I do that, I wanted to share about 5 minutes of slides just to really set the tone and to really show what COVID has really exposed that is desperately wrong with our healthcare system. So let me just do that really quick. Uh, so one step.
I don't know. Come on, let me see.
Okay. So hopefully you all can see this. I just wanted to, I really wanted to start this slide with a tribute to the late, great Shirley Chisholm. Miss Chisholm was very dear to my mom. She was actually the first person to hire my mom after my mom had finished graduate school and became a mentor to my mom. My mom came to the United States as a refugee during the Korean War. About 8 years later, she graduated with a master's degree at Columbia Teachers College, and Miss Chisholm was the first person to hire her and actually help her get her green card. Miss Chisholm then went to run for Congress and become the first African-American woman elected to Congress. And she helped my mom eventually become the head of Head Start in Newark, New Jersey. But in 1972, Miss Chisholm ran for president on the mantra of being unbought and unbossed. And unfortunately, we can say that not too many politicians live up to that mantra of being unbought and unbossed. And in 1972, she said, "We have never seen healthcare as a right. It has been conceived as a privilege available only to those who can afford it. And this is the real reason that the American healthcare system is in such a scandalous state." And I would argue that this is probably more true today than it was in 1972. And just, I'm going to give you maybe 3 or 4 statistics and then really get to the meat of what COVID has exposed. But just in the last, these are some pretty recent slides that if you look, we are spending more as a percentage of our GDP compared to all of the other industrialized nations. And yet our life expectancy is on average about 4 years less despite what we're spending. And you can see on the right-hand side up above, what we spend per capita. But more importantly, down below, if you look at the percent of people in our country that are facing financial real ruin as a result of their situation, despite spending what we do, you can see that no one's close to us by those metrics. So we're paying twice as much, have less life expectancy, and have more people that are financially vulnerable if they get sick. And for those of you who are part of a union and have run into resistance, this is the thing that I would ask people to really pay attention to. Despite, quote, the great benefits that you might have negotiated, you really don't really have great benefits. Each year, your wages have remained flat because more of your income is being taken out on the front end to pay towards your employer-sponsored healthcare. And then once you get sick, you're being asked to pay more in terms of copays and deductibles. Meanwhile, inflation has remained stagnant. And I would also say that many of you that have your employer-sponsored healthcare plans may be in jobs that you hate. But the reason you stick around and deal with the crap of being in a shitty job, and excuse my language, is because you have insurance that you might not be able to get in another job. And then the other part that you'll hear during the Democratic debates is that we want to give everyone coverage. Well, coverage does not necessarily mean access to care. If you look above, roughly 1 out of 3 people that has, quote, insurance delays seeking care because they can't afford the copays or deductibles. And if you look at how that affects our communities of color, it's a disproportionate number of people in our Latino community and our African-American community that delay seeking care. So when you hear people say, I want to give everyone universal coverage, that doesn't mean anything, because half the time the paper of the policy that you have isn't worth anything. So just to keep that in mind as we move forward. And you know, if you look at the number of people that report each month having difficulty paying their premiums, that has continued to climb. The number of people that say it's more difficult to pay their copays or prescription drugs has continued to climb. And the number of people that report that it's difficult to pay for their deductibles. So by every means, our current system is not really getting the job done. And let's not forget that 45 million Americans in 2017 reported that they didn't fill a prescription because the cost of the medication was too high. And 1 out of 5 seniors right now doesn't fill a prescription either. And yet we prevent Medicare from negotiating drug prices. So just to set that as a little bit of background at where we were pre-COVID, I think it's very important as we really try to fight for a better humane system. You know, we just crossed a horrible milestone a few weeks ago, and it's just climbing, and we've had over 350,000 deaths. And unfortunately, I think we as a society become somewhat numb to the number of deaths. And this doesn't even take into account the other toll that it has on families. And unfortunately, I think this is going to climb to 500,000 in a very short period of time. Right now, we're getting 4,000 deaths a day. So this is really, really a horrible situation. But this has really exposed so many lies about our current healthcare system. So one of the things that you'll also see is the deaths among communities of color. This has disproportionately affected disadvantaged communities and communities of color. And if you look at their healthcare access pre-COVID, many of them had uncontrolled diabetes or asthma or other situations. Some of them lived in communities where air pollution was so high, where we have legislators that continue to allow fracking and all sorts of things to happen in their communities. But also, you also have people that are in communities that have food deserts, so their nutritional needs are not as well. But more importantly, when you have uncontrolled medical conditions because of copays and deductibles that you don't seek the proper care, you have a much more vulnerable population, so that when something like COVID does happen, it results in a disproportionate number of deaths. And during the Democratic primary, you heard President-elect Biden slam Bernie and his plan and lauded, said, look at how many deaths you had in Italy and all of these countries that had, quote, a government-run healthcare system. Well, look at what's happened since that Democratic primary, right? The number of deaths in the US have continued to skyrocket, whereas all of the deaths in the countries that have a very moral, humane, single-payer or universal socialized system, their death rates have gone down considerably. So this was the first lie that you heard perpetuated during the Democratic primary. The second part you heard was Senator Klobuchar constantly say, Bernie, you know, a Medicare for All plan is going to kick millions of people off their health insurance, employer-sponsored health care. Well, you know, the pandemic has done that. If you look from, this is from October, it's been found that roughly 8 million people have lost their employer-sponsored health care, and an additional 7 million people who are dependents of these people that have lost their employer-sponsored healthcare have lost their coverage. So we've had 14 million people lose their healthcare coverage as a result of the pandemic, their employer-sponsored healthcare. But how many people, and then who are the people that didn't even have healthcare, right? The number of uninsured, the frontline workers, our cooks, our drivers, our cashiers, waiters and waitresses. So all of these people that didn't have insurance as they were getting exposed and maybe had symptoms weren't even going to the doctor maybe in a timely fashion, which further accelerated our pandemic. But let's look at how many people in other countries lost their employer-sponsored healthcare. 0. And this is another thing that I think is very important to understand about the lies that have been perpetuated about our current healthcare system. So I just have about 4 more slides. So we would argue, I think everyone on this call, that healthcare is a human right, not a job perk. And more importantly, if you look at Medicaid, you know, it's been a separate and unequal system here in the state of California. Because reimbursements have been so bad, a lot of patients can't find a doctor to even see. And this is the part where you see our corporate Dems in our state continually saying, we just want to expand Medicaid, right? We want to expand access, give everyone Medicaid. But you can't expand, say you're for, quote, universal health care if you are creating a separate and unequal system. So this is just to show you, this isn't, you know, the progressive wing that has been saying that it's separate and unequal. These are actual lawsuits that people have filed on behalf of the people who have Medi-Cal in our state, claiming that it is, oh, I'm sorry. One more thing. This is just showing you, you know, that universal healthcare would cause rationing, but now these are articles that just came out in the last 2 or 3 days saying that our LA hospitals are rationing care right there. And then this is the part that I was saying about Medi-Cal, that you have several lawsuits that have been filed in our state showing that our Medi-Cal system is essentially an apartheid, separate and unequal system. But who has done well during the pandemic? Look at the record profits for the United Health Group and Anthem during this period of time. And so again, I would argue, why are we getting so much and getting so little? We have this very convoluted system, right? You've got, some of you might have had your employer-sponsored healthcare this year through United Healthcare, lost your job, and now you've got Medicaid if you're scrambling for that, or maybe your company has now negotiated something with Aetna, and then you, or some of you turned 65 and now you're Medicare. But when you go to your doctor, they've got to figure out, am I in your network? What's your copay? What's your deductible? Oh, sorry, I can't see you anymore. I don't have a contract with your insurer. So it's this convoluted system that's adding all this administrative complexity to our system. And if you look at the number of administrators from 1990 to 2015 versus the number of doctors that have been trained, you can see it's quite just desperate. And then down below, if you look at the cost changes in expenditures, it sort of mimics the number of administrators that have been added to our healthcare system. So it's very mirroring the complexity that we have. But let's look at the administrative cost per capita that we spend on healthcare compared to what we spend on long-term care. So imagine if we could do away with the administrative complexity and use that to improve everyone's benefits, and especially long-term care with an aging population. Wouldn't that be a nice thing? But this is just to show you, again, all of the inefficiencies of our current healthcare system. And despite taking care of a older, sicker population that has more chronic medical conditions, more medications, Medicare has done a better job of controlling drug costs compared to controlling costs in general compared to the private insurance industry. So instead of this convoluted system, I think all of us here are basically saying, let's simplify the system by making a single payer system that will greatly enhance everyone's benefits, take care of our undocumented brothers and sisters, no longer have this apartheid, separate and unequal system. And the fact is, we're already paying for it. 70 cents of every healthcare dollar in the state of California is already paid for us by the taxpayer, whether or not we're paying it through our small businesses, giving our own healthcare, we're giving tax breaks to Google or Apple to give healthcare to their employees, all of the teachers, police officers, state employees that work for UC, the UC system, all their healthcare, we're paying for it. So if we're already spending 70 cents of every dollar with the taxpayers, don't you think we deserve something better than we're already getting? And just to conclude that right now, if you look during the pandemic, the overall support for a Medicare for All system is an all-time high. 76% of all voters, 88% of Democrats, 63% of independents, and even 69% of Republicans support some sort of Medicare transition during this pandemic. And despite this overwhelming benefit or interest and support, 88% of Democrats, we can't even get this a bill in the state of California. And that's where we conclude by saying, universal health care, it's not a radical idea. It's in all of these countries. Secretary Clinton likened it to giving everyone a pony. But I would say, where's our friggin' pony? The time is now that we need to do this. And I think the way we start to do this is all of you who are on this call that are running as progressives on your slates. The reason I think many of you are running is not just healthcare, but other issues. We have this Democratic supermajority, and yet we still can't get anything passed that's really of significance to really make a change in our masses. And the only way we can do that is to basically take over the party and start to bring in the change from within. So I really do applaud each and every one of you for running. I hope that we can all support one another to really move this forward. I think we can use the COVID situation to really highlight the urgency and that this cannot wait. As the governor is now looking at a potential recall attempt, from what I've seen, there's been over 1 million out of the 1.5 million signatures that have been collected, and they have 3 months to go. We should not let him take us for granted anymore. He needs to step up and follow through the promises that he delivered. That he gave when we supported him in his run before. The time is now, and let's do this. And so I'm grateful for each and every one of you for, one, taking the time today, but more importantly, taking the time to run for a delegate, ADEM. It's very, very important this time more than ever, and especially here in the state of California. So with that, just thank you very much. And let's go do this. And with that, I'm sorry, I forgot who I'm turning it over to.
Elizabeth, are you there?
Yes, I'm here.
Great.
Well, I just want to say thank you, Dr. Song, for that information. I think there is a lot of misinformation on what single payer and Medicare for all is trying to do. So my name is Elizabeth Trejo. I am running with Assembly District 41. I'm running for Assembly District 41 delegate, and I am running with AD41 People's Action Slate, 100% progressive. If somebody can drop our website so you guys can find more information about us. So one of the important policies that I support is Medicare for all, healthcare for all, single payer, however, whatever terminology anybody wants to use, because the bottom line is that I come from a working class family. My dad was a construction worker, and my mother is a domestic worker. So she spent about 30 years cleaning houses in Assembly District 41. And it's just very unfortunate having, grown up and realized that because of the job that my mom was doing, she was excluded from, a human right that is healthcare, access to healthcare. So I just want to thank everybody that is here joining us. I see a lot of people that I recognize, and I'm really humbled to be a part of this group just because I do recognize a lot of you, and I know you've been doing the work for many years. What I'm going to be doing is I'm just going to be introducing our speakers, and everybody's kind of allotted. You guys kind of know what time you guys were allotted. After a speaker speaks, we will have 3 minutes for a question that probably will only fit one. You can raise your hand on your little raise hand option, or you could write stack on the chat. And that's how I'm gonna try to, see who speaks. Again, thank you for joining us. And right now I'm gonna pass it over to a representative from Assembly District 51, Amanda McGill Staples. Are you here?
I am. Thank you, Elizabeth. Hi, everyone. Thank you, Elizabeth, for the introduction. My name is Amanda Miguel Staples. I am speaking on behalf of the People's Action, El Pueblo en Acción slate for Assembly District 51, and just super thankful for the opportunity to speak and share. Elizabeth, thank you for sharing your personal experience as well. My mother cleaned houses. I cleaned houses with her. And the only reason we had healthcare is because my father was a bus driver. So again, personal stories like that is, it's very vulnerable to want to share those pieces of you. So I do appreciate and wanted to uplift that. On behalf of our slate and our Assembly District, just wanted to highlight a few things about us. Our Assembly District is majority Hispanic Latinx. Approximately 70% of us identify as so. And, we've gone through a lot of data and numbers. Dr. Song, thank you so much for walking us through that. So as we know, we're all very much, I believe, like-minded folks that are really wanting to learn more about this issue. At the end of the day, health inequity has always existed in our county. Black and brown communities, COVID-19 has hit them disproportionately across the board. And specifically in AD41, East Los Angeles community has been amongst the top right now, ranking with the most cases. And for us, and this issue is something that's not new. People who've been public health advocates thus far can tell you how folks use the emergency room as healthcare coverage. And it's been a normalcy for so many folks. So healthcare workers, public health advocates, this isn't anything new to us. This is a national healthcare crisis. We are in a global pandemic. And yet we are still so used to seeing healthcare be tied and only accessible to those with jobs or those who can afford it. And that specific piece is something that we need to dig deeper amongst ourselves. And really, at the end of the day, all those numbers that demonstrate that it would be a return on investment of our shared dollars of our taxes. This is what it's what it's called, but this is our shared investment in our communities. For us to demonstrate and show that that is something that is still inaccessible because of white supremacy and the fact that we think it's mine and therefore I can't share. And I want to say it's as American as cherry pie. So for us, this is a huge issue for our assembly district as well, highlighting that 45% of our assembly district makes under $50,000. So our assembly district folks are not making the bare minimum to support a family of 4 in our county. That number is about $75,000. That's how much you need to support a family of 4 with 2 working parents. That's tough. You're short $25,000 to meet your basic necessities. That is utilities, that is a home, that is food. I spent this time during COVID-19 volunteering at FQHCs, Federally Qualified Healthcare Centers and clinics, to give food away for free and robust boxes for folks every single week. And the line hasn't gotten shorter, folks. It has maintained and grown, if anything. And some of the folks come and wait in line for 2 hours on end. Cars can come up and line up and will be around the block and some. And the type of cars that come in, this isn't just your hoopty and your junk cars that are coming. These are folks across the spectrum. And it is, and I feel like because we're inside, thankfully, if you can and have been able to, you are doing your duty, if not, to protect your family. But what people are seeing and have been seeing, I just don't think it's being amplified enough. So just wanted to share those pieces. And in our assembly district, it's felt especially hard because of the demographics, because of the wealth inequalities, and our inaccessibility to jobs and healthcare. So just wanted to tie that up real nice for you all. Our slate has a profound understanding that power concedes nothing without a demand. And that is honestly why so many folks have joined this call, are running for their assembly district slates, are running on slates and being organized, and not just, attempting to join this stronghold power of the California Democratic Party that is a huge part of our national Democratic Party. So we just wanted to share that we are in this, we are organized, and we are happy, and we believe that we have the insight and the tenacity to make this a reality. So just wanted to uplift all of the folks across the slate. We're advocates, we're your partners in this, and most importantly, we're your neighbors. And I think at the end of the day, that's honestly what we can promise you and what we're going to fight to do. So just again, thank you for this opportunity, and we're with you in this together.
Thank you, Amanda, for sharing. Now we're going to move to a featured speaker, and that is Jenna Harris. She is she's a nurse for Medicare for All. So go ahead, Jenna.
Thank you. Nurse, LACDP member, a bunch of other jargon and jazz. And most of you guys know me on this call. We go back to the retro days of 2015, which feels like it's now been 25 years ago, when we were on that first Bernie journey. So I decided to take this time to explain what is Medicare as it stands right now. I'm being honest. I don't want to sound like I'm being an anti. I'm not. I'm just being honest, and I'm going to poke holes. I'm going to make you think. I want you to think, because I am the person we are trying to eliminate, and that gives me a view that I wouldn't have had if I had not been in this current career path I'm in right now. So granted, I am trying to eliminate my own job, but that's okay. And it's needed, because as much as I help people because I take these extra steps that the system does not allow, that really is not made into the system for me to take. So like I said, I'm going to go into what is Medicare. So, if you guys have seen the great documentary Power to Heal, if not, please go watch it. It always makes me cry. But Power to Heal shows about how the inception of Medicare happened. On top of that, how it was actually married with the civil rights movement. And I say married because without the civil rights movement, Medicare probably wouldn't have been there. Without MLK and a lot of the civil rights leaders in the South coming out of Mississippi, and a lot of, the freedom fighters going up to DC and carrying the message of that healthcare with the civil rights movement, Medicare might not have been there. So just FYI, if you have not seen that, please look up Power to Heal. I'm pretty sure it's free somewhere. And there's screenings of it. We do screenings every now and then too with a lot of the different healthcare organizations. So Medicare funded by the Fed, if you're, working right now, you look at your pay stub, you see the Medicare monies go out. And so it's going, and it covers, right now, and then even back then it covers 65 and older, people with certain disabilities, and even in definition, CMS says certain disabilities. It really doesn't give you a list, it just says certain. And then people with end-stage renal disease requiring dialysis and transplant. So that's where Medicare covers right now as it stands, okay? And then there are 4 parts of Medicare, 4, okay? So you have Part A, and I scribbled notes. I really should have made this into a PowerPoint because I know somebody's gonna ask me about it, and I will when I get the brain power to do it, I promise. And so there are 4 parts to Medicare. So you have Part A, which covers inpatient hospital stay, right? And so they're typically premium free for Part A, okay? And so that means that if you've paid into Medicare throughout your life, throughout your career, like most of us have, if you paid in for, I think, a certain amount of quarters, I think it's like 35 or 40 something quarters, you get, premium free Part A. But if for whatever reason, let's say you had to spend some amount of time disabled or something like that, you didn't quite meet that threshold for coverage under Part A, premium free coverage, I'm sorry, then you could have to pay upwards of $458 a month for Part A, inpatient hospital coverage. That covers the inpatient hospital, skilled nursing facility, up to 100 days. So that's your nursing home. That's when we say skilled nursing or SNF. And then some home health care. And so when we say some home health care, I'm saying I sent a nurse to your house to do wound care or something like that. That does not cover caregiver. A lot of people ask me, I need a caregiver to take care of my mom or dad. And they're too much, I can't do it, I have to work, blah, 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 I need a caregiver. But unfortunately, I have nothing to give you because caregiver support is not covered under Medicare as it stands right now. Part B is your outpatient medical. So that's your typical insurance. That's your typical, I go to the doctor. That's what covers that visit is your Part B. And it's outpatient medical. It covers doctor services, specialist services, like an outpatient care. So, Part B would be if someone had to see Dr. Song, a portion of it will be covered under Part B. And I say a portion because he's a specialist. And with his specialty, it's not 100% covered. And so then, medical supplies, not all are covered, not all supplies. So people, let's say your mom, you need a shower chair, she can't stand up in a shower. She's older, and she maybe had a hip replacement, just can't stand up. Well, guess what? A shower chair is not covered. I'm sorry. I usually have to go on Amazon for people and find the cheapest thing I can find on Amazon and let them know. I try to get them to avoid medical supply stores because medical supply stores usually upcharge versus going to like Rite Aid. That's what I do. And then preventative services, also covered. So, but here's the thing, Part B has a premium. And this is where it sucks. So let's say most of our seniors are making less than $88,000 a year, right? Nobody's pension or retirement paying out that much yearly unless you were just fortunate enough to be in that field. And so the premiums for 2020 were about $144.20. That premium, unfortunately, has gone up $4 to $148.50 for 2021. That is for Part B only, okay? That is your basic service, right? So when people say Medicare for all, I don't want people to think that we're talking free. Because right now, people who know Medicare will be like, well, Medicare is not free. And I think a lot of us activists don't understand that. And when I come with this perspective, a lot of people look at me with some side eyes like, well, what do you mean it's not free? And I'm like, well, this is what it is. And so I encourage all of you to know what this monster is really. Because if we go around saying, well, it'll just be like Medicare, it'll just be like Medicare. Well, Medicare's got some big old holes, man. And we got to fill those holes up too. So we have to say, yeah, like what Dr. Burnby, I saw the chat, improve Medicare for all. And then we have to be able to explain that. What I like to say is Medi-Medi, which is Medicare and Medicaid together. And if you fit a certain income threshold, you get to actually have that. And that is the golden spot. That's the sweet spot. You really don't have to pay a whole lot. You get the best negotiated rates. So truthfully, what I want to say is Medi for all, but nobody would know what the hell I'm talking about. So Medicare for all. So then we get into now, here's where insurance comes in. So now Part C came in. Part C came in later after the inception of Medicare. And that was when the insurance plans were saying, hey, government, I need some of this. Run it my way, run me some money, I need it. But they were like, but in lieu, if you let us take part of this, the government program, will offer more services. Because Medicare, as you might hear it, Medicare is a like neck down service. Like dental's not covered in Medicare, vision's not covered in Medicare. I'm dealing with a situation currently right now where a poor woman is trying to get her mom into dental. Her teeth are rotted out. She's stuck in a nursing home, nothing to do because of COVID. I can't send her anywhere. And she needs to have a very extensive maxillofacial surgery because her teeth are rotted down to the root. Why? She doesn't have dental. She's 86 years old with no dental coverage. And how am I going to, and she can't eat because her teeth are so rotten. And so that's, another, like I said, another flaw here. But I'm going to get to that. So then Part C comes in with Medicare Advantage. Here comes your health plans. Here comes your United. Here comes your Humana. Here comes all of it. And they look really sexy. And they have all these pretty commercials and they have all these great things. They have brokers that come out and hang out in your PCP or physician's office. And, they're kind of just sitting there like swipe or no swiping, like come hither. Let me tell you about all these great things we have to offer. Now, I'm not going to completely trash it. Only because they do pick up things that some of them do offer vision and dental, which is very important. Our elderly with, glaucoma, we will only take up so much for glaucoma, you guys. It doesn't cure it. A little puff pass only helps grandma this much. But, at the same time, some of the plans that do offer it, that's really a great help. The plans that do offer dental, that's really actually beneficial to them. And they have a lower premium rate than the Medicare A and B. But here's the catch. Now we go into that administrative chaos that I work within every single day, which is you're on an HMO plan, basically. You're like, think Kaiser. And now you're on this teeny tiny network. Okay, so that's your sacrifice for taking Part C. You get a little bit more, but now we're going to slow it down. So your access is not as fast. I can't just sit there and run. You know what? I think I need to see an ortho doctor. Run, go see the ortho doctor. No. Now you've got to go through your PCP who has to put in a referral. That means that has to go through utilization management who has to pick a provider that is within network, and not just within network, but is it the best rate for the network? And then we send you a letter saying that you've gotten, you're approved and now you can schedule your appointment. So maybe 6 weeks later. That's not the way it was supposed to be, but, due to, benefit and cost and profit, that's where it is now. And so, maybe some more benefits, decreased premium, tiny network, maybe slowing down care, which is my beef. And then you have, lastly, going into Medicare Part D, which is your prescription coverage. That's another way health plans are in this mess, because the health plans offer Part D prescription prescription coverage. Now, if you have Part C, if you chose to elect Part C, then if your prescription coverage is covered in Part C, right? I deal with Part C or Part D, medication benefits, prior authorizations all the time. Dr. Song could probably give you some really horror stories of, people being, waiting too long for care. As IR, I don't know how many times I've pushed through things for IR. I've called offices myself, including California Hospital, just to get the darn codes to approve the auth. So that I can get this guy in the next day to start his interventional radiology. Nightmare, sorry, trauma. And so with Part D, it includes prescription drugs and vaccines and things like that. But guess what? It ain't free. And so then if you're paying a premium to Part D, and let's say you have Part A, B, so you don't have to pay Part A, most people don't. You're paying $144 a month to Part B, right, for your doctor. And then now you're paying premium from Part D. So let's just round it off. Let's say you're spending maybe $175 a month. and just for your insurance coverage, and this is 65 and older, people who are disabled, and we know that they don't have the money. We know that. And so that's where it goes back to what Dr. Song was saying, which is now you're picking and choosing your healthcare. Okay, and this is currently under Medicare. So I just want people to really feel what has happened. Was this originally how it was supposed to be? Hell no. But this is what happens when we hear what's going on in DC about how they're talking about cutting Social Security. Well, those cuts, I mean, they might be small, maybe paper cuts, but paper cuts hurt like hell. So, and now we're seeing the result of a bunch of little paper cuts that have happened over time. And our elderly are left in the wind. If you're not fortunate enough to be able to qualify for the dual Medicare, Medicaid, then you're left in the wind. And a lot of our elderly are not, because the income limit here in California to qualify for Medi-Cal, which is our form of Medicaid, I think is about $1,265 for one person. You can't have an income above $1,265, or you will not qualify for Medi-Cal, or you will with a share of cost, which nobody can afford because you have to pay it down. It's like a deductible. And so that's where it really gets tricky. And that's where the healthcare apartheid comes in. And so, I just wanted to go in there, but going back to the Part D, I've skipped over something which is really important about healthcare premiums, which is the donut hole. You might have heard this donut hole and you think Homer Simpson and ooh, donuts, but the donut hole is a coverage gap. And when people hit the donut hole, which a lot of elderly do, a lot of people who are really sick, once again, I'm going to use Dr. Song again, because I know he deals with oncology patients who have very expensive medications. They hit that donut hole, which I think for 2021, after about $4,130 are spent, the health plan isn't covering at the rate that they were. Now you have to pay up to 25% of your prescription coverage. And 25% of let's say, I like to use vancomycin. It's a heavy antibiotic, pretty cheap IV, but when you have to take it orally like a pill at home, because you got a really bad infection, that it just has to be that way, that sucker is expensive. And there is no alternate, there's no generic. And so when I have to send people home with this is where they actually hit the donut hole. And then they're saying, I can't afford the medication. And then I'm going back to the doctors like, well, they can't afford the medications. The doctors are telling me, well, that's the only medication that they can have. And I'm looking at them like, well, what the hell can we do? Then I'm slapping an IV and someone to send them home so that they can have this medication. So now I'm putting them at an increased risk of another infection by sending them home with an IV versus just being able to have a damn pill, because a pill is too damn expensive. You guys confused yet? I'm like, okay. One more thing. And then going just really quick, I'll touch on Medicaid, Medi-Cal. Okay, so Medicaid is the federal, the low income type thing, but it is delegated. It's ran actually by the Fed and the state. So it's like a house, Fed and state. And so the Fed and the state come together. Usually it's mainly regulated by the state, like California. That's why we have Medi-Cal and not Medicaid, because we have to be fancy and be California. But it is for low income children, low income, parents who are low income who have children, and then also pregnant women, people with disabilities. But it covers more. So it covers long-term care. So if grandma, it just can't come home, she just her care just needs to be too much and she just has to stay in a nursing home, that's where Medi-Cal comes in, okay? Because Medicare only covers 100 days of skilled care, which means if you're not skilled, like you're not doing therapy or rehab or doing some type of wound care in the nursing home, then we can say, you know what, it's time to go home. Just because it covers up to 100 days doesn't mean you stay 100 days. But then if you need long-term care, just overall nursing supervision, then that's where Medicaid comes in, or Medi-Cal and house covered. And so, but here's the thing, this is where we get into healthcare apartheid. Medicare, providers like Medicare rates. They're typically higher, they're good, we like Medicare rates. When I say, hey, I can offer you Medicare rates, providers typically do give me a little happy dance, right? They're like, oh yeah, I'll take it, whatever, Medicare rate. But Medi-Cal or Medicaid rate is lower. And a lot of people don't like those rates. They don't want to take them. And for a brief moment, when I injured my back and I exhausted all my benefits, as a nurse, I exhausted my benefits, I injured my back, and it's like 2015. I went under Medi-Cal for a while, right? My doctor, my PCP was at UCLA. I couldn't see my PCP anymore after being established with him for years because he doesn't take Medi-Cal. Huh, UCLA doesn't take Medi-Cal, huh. So then I was forced to a smaller, kind of like smaller clinic where the quality of care was vastly different. And so, I just have, that's where healthcare apartheid. So even though, yes, people under Medi-Cal have coverage, that is true, but it's shitty coverage and it's providers. I mean, I don't want to down every provider, but I mean, it's a lot of times with providers who don't give a shit because they're barely getting paid to care. And that's how it is. That's just what it is right now. But when we combine these things and really make it a complete coverage where we're, being able to negotiate for these rates at Medicare rate, but also being able to provide that universal coverage that Medi-Cal does. If we put them under one house, we're covered. We have a roof. But you have one half of the roof here, and then you're getting poured on with that, and you have another half here, you're getting poured on with that. We need to have a house. And that's what Medi does. It creates a house. But the healthcare apartheid is going to have to go somewhere. And so lastly, I just wanted to add, copay and deductible that was brought up. Deductible, you have to pay that down until your insurance coverage. Copay is something that you always have to pay no matter when you go to the doctor, like you have to pay $20 a visit to your PCP or whatever, just to clarify. But one thing I will say, and this is where I'm going to poke, I've noticed that countries around the world who are offering universal coverage are facing a problem, which is the cost of care is going up. The American healthcare system is expensive because we have been brainwashed by insurance commercials and by media to think that, I don't have to take care of myself because I can go to the doctor for that. For those of us who have the coverage. And when you get coverage, you think that, oh, I can just go to the doctor for that. So it is up to us as providers and as advocates of healthcare to also advocate health of people. Because if we don't keep our country healthy or get our country healthy, we will bankrupt the system because we just can't keep up with the cost of healthcare because people just keep getting sicker and sicker and older and older. So it is an investment on both sides. We have to get our government to invest financially, yes, but we have to be willing to invest in our own health, to take care of ourselves, to want to take care of ourselves so that we don't end up hyper utilizing the system so that it can be spread across to everyone. And like I said, this is just what I'm noticing. I think that we do focus too much on treatment, and not enough on soul healing. So that's, as a nurse, that's something I've always tried to really cover. And then yes, mental health is big too. And that's a whole, I could spend a whole nother topic on that one, but we do have to really, really support the mental health side because that's the most fragile part of healthcare that's just crumbled and we see it. Lastly, so I saw something pop in the chat about the Good RX and all those you see a drug commercial and they're like, oh, you can get a certain percentage off, yay. Well, that only works. It doesn't cover government programs where the most vulnerable need that copay assistance. It doesn't cover it. It only is allowed to cover people who are private insurance. So there's the catch to that. If you read the little fine print, it says it there. And so going back to ADEMS, I'm not running because I'm an LACDP member. So I was actually, I'm kind of automatically made into as a delegate, but I am was part of the Forward 54th slate, which is still a slate that is running in the 54th Assembly District. So I would love for you guys, if you're in the 54th, we would love your support. I would love your support for them because they are just like me. And I'll drop that link in the chat. So thank you for coming to my TED Talk about Medicare, Medi-Cal, and I really, really appreciate the time to be able to break it down like this. I'm sure I'll put it in slides eventually.
Thank you, Jenna. We're gonna keep moving just because we do have a lot of speakers today. If you guys have any questions for any of the speakers or any of the representatives for Assembly District slates, please reach out to each other. And after you speak, go ahead and, if you like, share your email so we can continue to communicate and stay together and organize to deliver healthcare for everybody. So next we have a PANA rep, Cheng Sim Ling. Are you here?
Yes. Hi, I'm Cheng Sim Lim, and I'm representing PANA today, which is a Progressive Asian Network for Action. PANA, I believe, is the only progressive identified activist group in the LA area, maybe even Southern California. Many of us met through, the Bernie campaign, API caucus and the Bernie campaign. And PANA was heavily involved in the SB 562 campaign many years ago, and is gearing up now, working, we hope, with many of you, in this re-engaged fight for single payer in California. And we think at PANA that the fight for single payer is a fight for justice and equity. That is fundamentally what it is. And that, for us to organize to win single payer in California, we can't really win if we don't use this fight to empower marginalized communities to address the inequities in our current privatized healthcare system, which we all know is a form of state-sanctioned violence. I mean, it kills. I'm not exaggerating. That's just the reality. But we also at PANA, want to go beyond thinking of healthcare just in, strict medical terms. And that we think the fight for single payer is a beginning for us to reimagine what we think about healthy living, and to value public health, which includes not just medical treatment and healthcare, but environmental justice, housing, economic issues. So to look at it holistically as public health, and that public health is the baseline for all our communities to thrive. And want to thank AD41 People's Action Slate for convening this event. And we look forward to working with as many of you as possible together to win single payer in California. As a first step.
Thank you, Cheng Sim. So now we're going to go with Assembly District 48 representative for that slate, Emmanuel Gonzalez.
Hello, can everybody hear me? It's good? Yeah, okay, cool, thanks. All right, my name is Emmanuel Gonzalez. I'm running on the challenging the establishment slate in Assembly District 48, and with some very talented people, and also people that are very involved in their community. So thank you for having us to be part of this. Some of the things that we want to see in terms of what our vision is for having single payer here in California is, of course, establishing a single payer system. But I think there's also a lot of emphasis on ensuring that doctors are doing their jobs correctly, and that we base it just like in the dialysis community, because I'm a dialysis technician. I've been leading the fixed dialysis campaign for the last 5 years. And it would create more of an incentive for doctors to not only take more patients, but as well as to give the best quality of care. And sometimes when we boost up rates, of course, we're going to find ways to pay for it. It's already mapped out. But that increases, that also ensures that doctors are getting paid fairly. And we want to ensure that doctors aren't turning patients away because they're not getting paid fairly. And of course, establishing a single payer system and bringing in the required revenue would ensure that. Some of the other things that I think that is important when establishing either a single payer system or a universal healthcare system is also putting an emphasis on the quality of care. Like I work in dialysis, and I'll tell you that the quality of care is not good. I mean, especially during this pandemic, the dialysis corporations have not met the moment to care for COVID-19 patients. they end up putting more strain on the hospitals. And as a result, people are left to die. It's so, and with a single payer or even the universal healthcare system, what we would see is we would see more, of course, resources being pushed into various facilities, and they're not going to be not taking patients because maybe they might take a loss or because they don't want to feel responsible for doing that. With a single payer or universal healthcare system, it would ensure that dialysis patients are getting the care that they need in order to stay alive. And so those are some of the things that we, of course, all support. In terms of what would it mean to go forward with a universal healthcare system or a single payer system here in California. And those are some of the things. And I think it's very important to note that for us, being members of the party, that we find it unacceptable for other members to be taking money from big corporations like DaVita and Fresenius and their union busting organizing efforts with dialysis workers. Alex Rooker is one of them, taking $30,000. It's time for us to take over the party. It's time for us to write in the laws of our party that that we can't accept big corporate donations, or we can't be consulting with them when we claim to be not only pro-union, but also pro people of color, pro single payer healthcare. You can't do that when you're taking money from the devil, and they're the ones that are making this thing worse. And it has influences on elections, just like with Prop 8 and Prop 23. So those are some of the things that we stand by, ensuring that the party is put in check like that.
Thank you, Emmanuel. And after Assembly District representatives running for ADEMS, go ahead and, after you guys speak, go ahead and drop your information. So if people want to learn more about you, they can find you. And now we have one of our feature speakers, Erica Ferriston.
Hi, everybody. Emmanuel, that was amazing. I keep hearing the name of your slate as F, the Establishment Democrats, but I don't think it was that. So you should definitely drop the name. So again, my name is Erica Ferriston. I am the director of Healthcare for All Los Angeles, along with Maureen Cruz, and co-chair of the Los Angeles chapter with Betty Dumas Toto. I know I've seen Maureen making amazing comments on here. I'm hoping Betty's on here as well. Thank you, Una and Steve, and all of you amazing slates for organizing this town hall. Thank you, Dennis, for being Zoom tech guy. And yeah, thank you, Gina, for that incredible education on Medicare. I think your presentation really debunked the opposition talking point that single payer is complicated, because the shit we have now is what's complicated. And single payer is not. It's really simple. So I'm just going to break down for you briefly what single payer is, because sometimes the other day I was in a meeting and I was hearing somebody within a single payer organization talking about how complicated single payer is. I was like, no, it's not. So let's get the basics down. Single payer / improved expanded Medicare for all system is the most cost-effective way to guarantee the same high standard of care for everyone. Healthcare dollars are pulled from all current sources. Government now paying 70% of all healthcare costs in California. Individuals and businesses, a public agency pays the bills. A really easy way to think about single payer is it's one big healthcare GoFundMe. That's what it is. Public pays in, everybody gets the healthcare they need, The public agency pays the doctors, the hospitals, etc. So there's 4 key features of single payer / improved expanded Medicare for all. 1, universal coverage. That means everyone is covered for life, regardless of employment status, income level, age, health condition, marital status, immigration status, race, sexual orientation. Everyone is covered for life. Second main feature is comprehensive care. All medically necessary care is covered, including outpatient visits, hospitalizations, ER, surgery, dental, vision. See, right now that's not covered under Medicare, but it is under Medicare for all. Everything's covered: hearing, prescription drugs, mental, reproductive, home health services, substance abuse recovery, hospice, and long-term care. The third main feature of single payer Medicare for all is choice of providers. Patients choose their doctors, healthcare professionals, and hospitals. There are no more restrictive networks. I mean, that was pretty complicated, what Gina just laid out. All of these networks, what's included, what's not included. Everything's included. You go where you want, to who you want. And the last thing is affordability. Single payer saves money by negotiating prices for services, drugs, and medical supplies, but really it saves money by removing industry profiteering. So the insurance companies are out, which leaves us, remember, we're already paying 70% of healthcare costs right now, and only a small number of people are covered. So we get to keep that, and we get to, we don't waste the, the spending costs that these for-profit driven insurance companies drive up. And with everybody in and nobody out, individuals and businesses pay less for healthcare. So it's less money out of your pocket when you have single payer healthcare. There are no deductibles, there are no copays, there's no upfront costs. So that's kind of basically what single payer is. So who benefits? Individuals and families benefit. Everyone gets the care they need. No one suffers, goes bankrupt, or dies because of inability to pay. Coverage is not tied to employment, as we discussed. So Dr. Song mentioned people are freer to change jobs or start a business or just live their damn lives. So individuals and families benefit. Businesses benefit. Well, how do businesses benefit? Well, with predictable and lower healthcare costs, employers have more budget control, no hassles with health benefits, and greater ability to raise employee pay, which I think we need. Billing expenses for employers plummet. But anyway, so I'm moving on to health professionals. So doctors benefit because they actually get to determine the care that their patients receive instead of fighting with insurance staffers, executives who are telling these doctors, now can't do this, you can't do that. So they get to actually do what they're meant to do, be of service, help heal people. Their billing expenses plummet. I think it's Dr. Song and Dr. Bill Honigman, who I know is on here, and Dr. Ron Birnbaum, I see him. But I think it's estimated that doctors are paying about $90,000 a year to keep, just to pay for billing for their insurance company. So they get to keep that money. So they actually save money, save stress, and have more job satisfaction. And finally, communities benefit. I heard Patrisse Cullors, the founder of Black Lives Matter, say once, We have to move from an economy of punishment to an economy of care. And single payer Medicare for all greatly moves us to an economy of care. Cities, schools, and other public employers now paying private health insurance prices can invest saved taxpayer dollars in improved public services. So everybody except the greedy and capitalist white supremacist insurance industry wins. They lose. So that's basically what single payer is. I want to talk about a little bit about the opposition. They're good. They're really stealth. Bottom line, anything that delays, distracts, or diverts us from a single payer Medicare for all system, that is the opposition right there. So a public option, which I'm starting to see some progressives tout as this is what we should be working toward. A public option is no option. That is not single payer healthcare. And I pulled up from one of my favorite sites to find information. My first favorite site is Healthcare for All Los Angeles, but one of my other favorite sites is PNHP. Got a shout out to you, Dr. Song. But if you go on PNHP, they have this really great flyer that compares single payer to public option. So here's the difference between single payer and public option. Single payer is universal coverage. Remember, we talked about that. Everyone in, nobody out. Doesn't matter your job, doesn't matter your age, everybody in, nobody out. Public option, millions remain uninsured or underinsured. Coverage. Single payer, coverage for all medically necessary services. Public option coverage. Insurers continue to strip down policies and increase patients' co-payments and deductibles. And then you don't get that shower chair your mother needs that Gina talked about. Cost, single payer. Single payer redirects $350 billion in administrative waste to care. No net increase in health spending. Public option, increase health spending more than $1 trillion over 10 years. So single payer saves lives and saves money. Public option doesn't save as many lives and actually costs money. And we're just now, that's the next thing on here. Savings, or I just did that. Okay, sustainability, this is the last one. Large-scale cost controls, global budgeting, capital planning, etc., ensure that benefits are sustainable over the long term with single payer. With a public option, uncontrolled costs ensure that any gains in coverage are quickly erased as government is forced to hike spending or slash benefits. So I know that's a lot of information, and I'm loving this guy who's laughing right here, John Doyle. I like your laugh. Bottom line, public option is no option. Dr. Song is an expert on this. He doesn't know this, but we're going to invite him to a meeting to really dive down in the difference between single payer and public option. I'll hit you up about that later, Dr. Song. And anything that delays or distracts or diverts, genuine single payer, that is the opposition. So here we are. In California, we have a governor who ran on single payer. We have a supermajority Democratic legislature. That means they can pass anything they want, from housing to fracking to healthcare. And single payer is in the California Democratic platform. And yet we're 2 years into Governor Newsom's term. We still don't have single payer. And I just want to see a raise of hands. I just find it appalling, even before the pandemic, that we're still begging for Governor Newsom to give us single payer health care. So if you guys feel the same way, raise your hands. And I hope all of you running on the ADM slates are raising your hands, because we are going to need you for, we're all of us Bernie people are used to the inside outside strategy. I'm going to be on the streets, but we need you guys on the insides to make this happen. So one of the things Healthcare for All Los Angeles is doing in trying to urge the governor is we are kicking off, it's called the First 100 Days campaign. It's going to be kicked off on January 20th. And that is where we have 3 demands of Governor Newsom. And you all, ADEMs, come and join us and help us take it to the next level. When you all get elected, take these demands. The first demand is that the governor apply for the necessary state innovation waivers from Health and Human Services within the first 100 days of the Biden administration. I don't know why this hasn't been done before. Covered California applied for those waivers in December of 2016. Get a staffer, fill out the paperwork, get it done within the first 100 days of the Biden administration. Number 2, we demand that the governor lobby the state legislators, that's supermajority Democrat, to introduce a California single-payer Medicare for All bill, and we want the governor to promote its passage, and we want this done within the first 100 days of the Biden administration. And the third thing that we are urging the governor to do is we want him to publicly pledge to the people of California that he will actually sign that single payer legislation when it gets to his desk before the end of his term in 2022. So check us out come January 20th. Healthcare for All Los Angeles, hcala.org. Come and join us. We're going to be pushing out this campaign, hashtag First 100 Days campaign, hashtag California Lead the Nation, hashtag Medicare for All. So appreciate all of you for being on here. And with that, I will turn it over back to our host.
Thank you, Erica. And just thank you for that. And go ahead and put your information or the information so people can follow up. Now we have Kenneth Mejia.
Hey everybody, my name is Kenneth Mejia. Thank you, Pana, the Future Left, everyone here for attending and making and fighting for healthcare as a human right. I myself am definitely a huge activist of single payer Medicare for all. In 2017, when SB 562 was at the core of healthcare in LA, we organized a protest and sort of a march that brought about over 1,000 people in LA to bring about awareness. And we had amazing speakers like Dr. Paul Song himself. And now more than ever, it's pretty clear that healthcare should be a human right, right? And unfortunately, it's not, right? In other industrialized nations, these countries, these governments are paying close to 8% of their GDP to healthcare, whereas here in California, or even here in the United States, we're paying close to 17%, even upwards of 20% to our GDP in healthcare. And that's because we have a lot of private for-profit health insurance companies that are taking advantage of the system, right? A lot of the things that we pay for is going to administrative costs, exec bonuses, and whatnot. And so I timed myself perfectly because I only want to do this for 3 minutes, but let me, am I allowed to share my screen? If not, then no worries, I could just talk about it. But you know, amid the pandemic and whatnot, we have a lot of big private for-profit health insurance companies making so much money, right? In Q2 of 2019, United Health Group had $3 billion in profits just last year, and in just one quarter. And then this year, during the pandemic, United Health Group has $7 billion in profits during the pandemic, and it's really it really shows that how messed up our healthcare system is, and how these health insurance companies that make profit out of our health are just doubling their money while many people are losing their jobs. they're not being able to they're losing their health insurance because they lost their job, and that's exactly the reason why we want single payer, so that's not tied to their jobs at all, right? And so, you know, in 2020 in the elections, the health insurance and the pharmaceutical industries gave a total contributions to candidates running of 565 million, right? And of that amount, 250 million went to Democrats and 141 million went to Republicans, and the other was for outside spending. And when we ran and when we pushed for SB 562 in 2017, it got squashed by, you know, one person, and it really sucked. The Speaker of the California Assembly, and it was Anthony Rendon, and over his career, he's received over $800,000 related to health insurance or pharmaceutical companies, including the California Medical Association, who was heavily against SB 562, from DaVita, from Pfizer, from all the big gigantic, you know, Gilead Sciences, Genentech, all these giant pharmaceutical companies and health insurance companies just against single payer. And so, you know, as an activist myself, my job is to highlight, to expose, and to educate people about what's stopping us. Because like Erica said, we are a super democratic legislature here, and we could pass anything that we wanted, but we're just lacking the political will. So I'm happy to be here. I'm happy to fight with all of you. And, you know, so many of you have spoken about this amazing topic and technical standards. And, you know, I just can't wait to be out there on the streets to make this a human right here in California. So thank you.
Thank you, Kenneth. So now we're going to move on to Assembly District 57 Representative Stephanie Terrazas.
Hi there, Stephanie from Hacienda Heights. I live in AD 57, Congressional District CD 39. I just wanted to highlight that because recently we had Gil Cisneros, our congressman, lose his election to a Republican, Kim Young. And I had repeatedly asked him to support Medicare for all, and even told him towards the end of his election that we would help him in his campaign for the district, and he never was on board. Anyways, I just wanted to thank Gina for her little, not her little, but her tutorial on Medicare. I do work in the healthcare field, and I see it all day, every day. People who can't get second opinions. I work in the pathology department, and it's really sad to see that it's part of my job to deny people the opportunity to have a second opinion from UCLA doctors because they can't afford it. We'll get international patients that come from, you know, China, the UK, the Middle East, that have a lot of money, and they're only because they can afford it and they want the best that they come to us. But the people who live here and work here and, you know, have families and, you know, just want a second opinion, sometimes I have to send them the bill. And I don't talk about it a lot because it's very sad. And that's my job, that's what I get paid for. But what I am happy about is if one day, if single payer does get passed, that I will lose my job and then I can do something I really enjoy. In AD 57, for over 4 years, myself and a bulk of the people on my slate have been working on SB 562 to Medicare for all, nonstop, all the time. It's always on our mind. We live it, breathe it. It's just a part of us. And I'd also like to mention that, you know, although it is concentrated in AD 57, we work with other ADs like AD 48. We help each other out when it comes to promoting each other's events, when it comes to single payer healthcare recruitment, promoting and attending. And we're just a single payer healthcare family. And I guess I'd like to take this opportunity to promote, and I know we all have our healthcare organizations that we work with. Right now, I'm committed with the nurses for a car caravan, February 6th. Some of you may know about it. We are meeting at the community center in La Puente. If you would like any more information, please let me know. We're Democrats for Justice, and the car caravan is at 12, and we'll be going from La Puente to West Covina. And I think that's an area that really does need, we all need single payer healthcare, but they are very like an unheard and underserved community. And it is my honor to help bring awareness to those areas. And it is an honor to be on this call with all of you. And that's all I have to say. Thank you, everybody.
Thank you, Stephanie. So now we're going to move on to another featured speaker. And again, if we have any questions, we're going to hold off till the end. I'm going to start, just to respect everybody's time, I'm going to start raising a little one when you have a one minute left. And then I'll go like this when your time is up, just so we can get to the ending and open up for questions. So go ahead and you can go ahead and go Dr. Bill Honigman.
Perfect. Thank you, Elizabeth. Thank you, everybody. Great to be with you. Thanks to especially the organizers of this forum, and especially everybody who's running for the ADEMS. Thank you. I appreciate that. I'm Bill Honigman. I'm a retired emergency room physician from Orange County. Actually grew up in Monterey Park, Montebello, and my father was a family physician in East LA, where I worked for him in summers all the way through med school and everything. And then I practiced emergency medicine here in Orange County for Kaiser for over 30 years. I had the opportunity to see, Kaiser patients are generally working class folks who, many of them fell through the cracks even when they were part of a integrated care system. So I had the personal experience as a physician. That's why I'm very proud to be a part of Physicians for National Health Program, like Paul and Ron and others here. But I'm also a bit of a political junkie. So a lot of you know I'm involved both inside and outside the Democratic Party and organized with Progressive Democrats America. I'm presently serving as the Southern California Vice Chair of the Senior Caucus of the California Democratic Party, and am an elected member to my county central committee here in Orange County. So I do appreciate those of us who took up the challenge, as Bernie said, to get into enter into the party and change it from the inside and reform it. And I just want to add a couple of things that I think, there were terrific discussions already on kind of the basics of single payer Medicare for all. And I want to add a couple of things that I think a number of my fellow advocates may not have said so far. I'm just going to share a graphic that I think many of you have seen, if not most of you. Are you seeing this graphic? Give me a thought. Right. Thank you, Elizabeth. This simply shows how we pay for healthcare in America versus how they do it in Canada. And I think you get the sense here of the complicated, immensely complicated system. Here's where you submit a claim in America. Here's where the bill is paid. And here's the jumble that our wonderful friend Gina Harris was describing in some detail. Even with Medicare and Medi-Cal systems that we have, you still have this incredible, spaghetti on the wall mess that we have for paying for healthcare in this country. And the friend of mine who developed this graphic actually says there's probably 4 or 5 layers to this mess that we have. When we look at this, of course, we think of the incredible waste administrative waste and all of the claims administration process that Paul showed in his graphic, where we've had a development of far many more administrators than actual care deliverers in this country for decades now. But this is also an opportunity for fraud and abuse. This is the way they hide surprise bills and do negotiated backroom deals between providers and hospitals. This is where pharma hides things like pharmacy benefit managers and price their products, which are really a mafia extortion model of doing business. So, and this is one more thing that I want to bring to mind, is that this is what's being magnified by COVID, by the pandemic, is a magnifier that magnifies the waste, the fraud and abuse that results in the loss of lives as well as dollars. So the cost and incredible pain and suffering and loss of lives happens because of this that we're now experiencing due to COVID. So let me go over that in some detail from a political point of view now, as I think is kind of important for us to look at. For example, the US right now has 1,140 deaths per million of the population compared to Canada's 442. That's about 2.5 times per capita COVID deaths in the US compared to Canada. That means out of our total 370,000 deaths so far due to COVID, that number could be cut in half. That's more than 100,000 lives saved, close to 200,000 lives saved, if we simply had a system like Canada's to deal with this pandemic. One thing to realize too is that the federal government, of course, can print money. States cannot print money. The federal government can, and we need to be advocating for the National Defense Production Act to print money as if we were going to war against this virus. So why are we not hearing that from our congressional, even good representatives like my own Katie Porter? I happen to live in her district. Why are we not hearing about the Defense Production Act being applied to healthcare in this situation? One more thing about national, and then I do want to touch on regional and local, and then I'll turn it back to the discussion with Ruth. Our good friend, Dr. Don McCann, he's a retired physician in San Juan Capistrano, and he's a PNHP senior policy advisor, writes a very wonderful thing y'all could subscribe to called The Quote of the Day. He wrote 2 days ago the following. President-elect Biden, he says, has stated that he will not approve a single-payer Medicare for All program. That does not mean that we should walk away and wait another 4 years. It does mean that the political threshold has not been met to expect enactment in the near future. And that means that our task is to expand our effort to educate the public as to the features of the single payer model that make it a moral imperative. So instead of having less to do because of Biden's rejection of the model, it means that we need to greatly intensify our advocacy efforts. And that means we have a lot of work to do. It is an imperative that a national single payer improved Medicare for All system remains the ultimate compelling goal. That's Dr. Don McCann, a PNHP senior policy advisor. We're lucky to have him here among us. On a regional local level, again, thank you to all the ADEMs running. Of course, if you don't win your election, you can still be involved. At the state party, you can attend all Democratic conventions, standing committee meetings, caucus meetings. The state party needs you to be involved, as does your county central committee and Democratic clubs. Of course, we need more street actions like so many in this group do so effectively, like the Rose Parade and being at Hamilton shows and all of that. But even events like this, town halls that serve to raise awareness, movie showings. We need to engage the electorate, right? Get voters engaged, and that will ensure turnout. These resolutions of governmental agencies and of these various committees, the Medicare for All resolutions. Thank you so much, Ching Sim, Sean. I see you in the group, and everyone who worked so hard to make that happen for the city of Los Angeles. That needs to continue, of course, that we pass these Medicare for All resolutions, because that then, paradoxically, pushes our local leaders to actually follow us in this movement. And also we need to challenge all candidates. What is their position on Medicare for All when they're running for school board, when they're running for water district? They should be able to articulate that, yes, it will save money and save lives in my community, and that's why I'm in favor of it. Even at that very local level. And then finally, of course, thank you everyone for your engagement in all of the various local advocacy groups like Healthcare for All Los Angeles, PNHP, CARA, the California Alliance for Retired Americans, California Nurses Association, NUHW, National Union of Healthcare Workers, and my own group, Progressive Democrats of America. We all should be extremely thankful and grateful for the advocacy of everyone here. So with that, I'll just turn it back to our host, and if we have any time left over for discussion, once again, thanks everyone.
Thank you, Dr. Bill. Now we're going to go to the future left, Matthew and Ji-Young.
Hi, my name is Matthew Donovan. I am the founder of the Future Left, and I have with me Ji-Young as well. So I'm really happy to not necessarily be an organizer of Medicare for All, but to be one of the organizers of ADEM slates for the past couple of years, and to be one of the main organizers of bringing this coalition together. I think that every election is an opportunity for us to bring people together that may not know each other, but may be doing the same work in different areas. So I'm really appreciative of everyone that came together from all of these different slates in these different areas. Some came together pretty last minute. Some people came to speak after talking about this for a week ago, and some came just after talking today. So thank you so much for building one aspect of this. The electoral is one piece of this, but electoralism without organizing is almost always going to benefit the elite class, who in turn will push austerity policies. And Medicare for All is not an austerity policy. It's a program against the austerity state that we live in. So with that said, I want to pass it on to Ji-Young. Ji-Young, are you with us?
Thanks, Matthew. Thanks for putting this town hall together along with the AD41 slate folks. So I just want to talk about my reason for fighting for Medicare for All by running for in the ADEMS election. I'm actually HIV positive, and before, it's the first time I'm saying it in public, so before I worked at my union job for 6 years, I paid almost $900 in premiums for health insurance. And as an attorney who wasn't doing evil work and had a huge debt burden, it was really hard for me to pay that $900. And luckily, I got a job that had employer provided insurance. And I quit that job recently because I wanted to devote more work to the things that I really believe in. So now I do not have employer provided insurance, and I'm currently paying Cobra, and it's almost $800. As somebody who still has debt, even after being an attorney for 20 years, it's hard. When I don't have a corporate job that pays me a ton of money. And when I do get on ACA, it's going to be almost $700. This is somebody I'm talking as somebody who has a JD and is a practicing attorney. And if I'm struggling to have healthcare, then think of all the people who don't have JDs or professional degrees who are struggling and don't have healthcare. I'm lucky to have healthcare right now. And there are millions who have lost their jobs during the pandemic, who are afraid to go to the hospital, even with COVID symptoms, because they don't want to be stuck with thousands and thousands of dollars in medical bills. So I have a very personal investment in doing this work. And so I'm very honored to be in this fight with you all.
Thank you so much for sharing that. I know it's very difficult to share our vulnerability, but I think that's what makes us all great. Even though we come from different backgrounds and we look different and we're from different ages, we're all willing to step up for one another and not let you go through this alone. And I'm just, again, really glad to be able to be a part of these organizers that have been doing the work, that continue to do the work. And like Dr. Bill said, even if we do not get elected as delegates, we still have a responsibility to engage with our community. So thank you again for sharing. We're now going to move on to Assembly District 64 Representative Brandon and Richard.
Hi. Hello, everybody. My name is Brandon. I am with the People's Voice slate for AD64. I'm running I am running on the only progressive slate for our district. So I'm very proud of that. I'm also proud of being someone who is from my community. I pretty much has been involved within my community, specifically within the Harbor area, to fight against environmental racism within Los Angeles. The issues between environmental disparities are connected with health and connected with healthcare as well. We look at the root, right? Like we look at what, basically what goes from the causes of illness to the treatment and of illness as well, and the disparities there are to access of healthcare. Within my district, there's a lot of mixed status families. So there's families who are undocumented and families who are documented and families who have, folks who have citizenship, right? So that creates that divide within families of who gets to go to clinics, who gets to go to the hospital, correct? And imagine that being a young child, having to have a parent that pretty much holds the household down, but they can't get healthcare, right, when they get sick. So what happens to the household then? It's a trickle down effect of cumulative impacts amongst the community, right? So even with myself, on a personal level, I've suffered with asthma my whole life, right? And for me, single payer healthcare is something that is much needed, not only for people like me, but folks who within my district, which is the most polluted district within Southern California. Even California, we're the home of the largest refinery west of Mississippi. We have the Port of Los Angeles. We have 73% of the oil drilling sites and within Los Angeles, just within one of the cities, which is Wilmington, you know, in the district. So, you know, the discussion about single payer healthcare goes even beyond just having healthcare in general, is even having the access within having a healthy environment, right? So for me, you know, being able to be on the People's Voice slate and representing, you know, the communities that are on the frontline communities is very important. So single payer healthcare is one of those issues that hits home with every single one of us within the People's slate. And we just saw, you know, Paul shared the statistics about, you know, Indigenous folks having, you know, having access to, you know, healthcare within COVID. I myself, I am a Indigenous person. I'm of the Quiche Kakshigel Nation. So seeing that even hits even more home. So I'm very appreciative of the discussions that we're having about single payer healthcare, because you know that ties with a lot of the issues that happen within our community, specifically in AD64.
Thank you. Thank you, Brandon. We're going to go ahead and move on to one of our featured speakers, Jenny Chang.
Hi, everyone. Can you hear me okay? Can you hear me? Yes. Okay, great. Thank you, Steve, organizers and sponsors for the invitation and for leading with the issues. And thank you to all the passionate and wonderful speakers who have joined today. Thank you for the courage of your convictions to show solidarity and love as we may be coming from different spaces to fight alongside each other against the greed in healthcare. It is a privilege here to be with you all and not a moment I take for granted. It's so important that we continue to lift up those who represent directly impacted communities and those who are struggling, especially now, raising up the struggle of immigrants, LGBTQ+, Black, Indigenous, and POC communities, seniors on fixed income, the unhoused, and so many other vulnerable communities, as we have so much to address when it comes to health disparities and inequities. But one thing that everybody agrees on is that single payer is a fundamental systems change that needs to happen to get the greedy insurance companies out and to give the public the power to negotiate like a boss against the medical industrial complex. I'm here to talk about two things. One is the letter to the governor and the other is the petition for the waiver. I'm going to share my screen. Let's start with the petition. If I change my tab, can you see this? Do you see the petition? Great, okay.
Yes.
All right, so if you haven't signed this, please sign it and share it, get it out there. This is a letter to be signed by all and any public, I'm sorry, anybody can sign this letter. We're trying to get to 1 million signatures within the first 100 days. There's a big push. PNHP put an email out, PDA put an email out, thank you. HCA is putting out an email to their groups. But we really need to break out of the walls of our echo chamber. And we are asking the governor to request the waiver from the Biden administration so that California can implement its own single payer state system. And this is not a provocative ask. The governor already requested the state waiver from the Trump administration, right? It's very good. And so now is a time to let the governor know that we have not forgotten his good deed and his amazing gubernatorial campaign advocating for single payer. And we want to be 1 million strong saying, hey, let's go, let's do this. California is ready. We want the Biden administration to know that California is ready to go. And we're fighting for this. We haven't forgotten. And the second document, the petition address is petition.healthcare. You can put www in front of it if you like. And if you want to become a sponsor, an organizational sponsor, sign up on Action Network and make an account for your organization, and then let Eric Vance of Healthy California Now know. If you sign up as an organizational sponsor, I'm putting his email address in the chat. You manage the contacts. That belongs to you all to manage. So you communicate and you can keep track of who's coming in through your link. the next, the next document I'm sharing is the letter to the governor. Can you see this one? It's blue. Okay. Thank you for those who are nodding. I see like only 4 people on my screen, so it's helpful. Okay. The letter to the governor is to be signed by elected officials, any and all elected officials, ADEM delegates currently sitting, and candidates. So if you're a candidate running for ADEM, please sign this. The ultimate purpose is to show the Newsom administration the undeniable support of single payer, that it's proudly and publicly signed by all. And we have a link to show who the signatories are among the ADEM candidates. And I'll drop that in the chat as well. So if your name's not on this list is being updated. Thank you for those who have signed. It's being updated, I think every 1 or 2 days. We're all at capacity, we're doing the best we can. But please sign, it will be updated. And you can, refer the people you're, whenever you're campaigning and say, hey, our slate's members are showing up on this list, and share it. And if you're advocating for a slate, please ask them to sign it. The next thing I want to say here, let's see. Did I share everything? Okay, this is the list of candidates. That signatories list will show you this. And lastly, I have a video to share. I'm trying to do this in my 7 minutes. The video, do I need to disconnect? Let me see. I think I need to disconnect and reshare for that file. So I don't know how else to do it. 1 second. Bear with me. Okay. So I'm going to give credit to East Bay DSA, who put a lot of work into this and got it together in like a week's time. But it's a video for the petition asking the governor for the waivers. Here we go. I think I need to unplug my earphones.
Governor Newsom. California needs single-payer health care. And we need it now.
Single payer means comprehensive health care,
Including medical, dental, vision, hearing, mental health, reproductive health, and long-term care.
Está garantizada. With no copays, fees, deductibles, out-of-network, denial of coverage, or bills.
We needed this before the pandemic.
And it becomes more critical each day.
You have the opportunity to make long-lasting improvements to our healthcare.
By persuading the Biden administration to grant a federal waiver
to expand and significantly improve Medicare for all Californians.
我哋記得喺川普上場嘅第一日，你都有咁樣做。
Now do have the support and the urgency
to fulfill your campaign promise.
So there's no reason to wait around on universal health care and single payer in California.
We agree. And we understand the power of the health insurance and pharmaceutical industries and the millions they'll spend trying to defeat our efforts.
But we're stronger together.
Governor Newsom,
We are calling on you
To lead the way for single payer in our state.
and our nation.
Californians, please join our fight. Add your name at petition.healthcare.
Thank you all. Thank you for all you do. There's space for everybody here. Actions, DSA, HCALA, they do amazing actions. If you're interested in pushing petition, there's room for everyone. Thank you for all you do. And if you have anything I can help you with, please feel free to reach out. As suggested before, my email address is in the chat.
Thank you, Jenny.
Thank you, Jenny. Now we're going to move on to Assembly District 66, a representative for the delegates running over there. Oh, wait. Oh, yeah. Dr. Richard Wynn.
Hello, hi. Can you hear me okay? Okay. Hi, my name is Richard Wynn. I'm here on behalf of the South Bay People Power slate at Assembly District 66. I'm a pulmonary and critical care physician here in Torrance, California. I just want to first say thank you so much for organizing, and thank you to all of the speakers and all of the people here. It's an amazing display of strength to see so many people here and part of this vision. And I really am honored to be here, a part of you all. Just hearing the stories throughout this evening has truly inspired me, and I can't say much more than that. You know, one thing that we're fighting against is a healthcare industry that has spent billions upon billions of dollars lobbying. In 2019 alone, over $500 million was spent to lobby and to spread misinformation about healthcare for all in a single payer movement. And so it's great to see this grassroots effort at spreading information and getting the information out there for the public to know. And I think it starts with us at this level and through campaigning, through like ADEMS, to truly affect change and to get what we truly need, which is a single payer policy or program here. You know, throughout my professional career, I've worked at many different various levels of healthcare, from the county level to private to academic level medicine. And, you know, constantly at every single level, I'm amazed by the disparity of care, by the hoops that we have to jump through to get patients the quality care that they deserve. I think that one thing that we need to focus on is not just those that don't have coverage or don't have insurance. We also have to look at those who are underinsured. And then we have to fight for those people as well. Because sadly, even for those patients who have health insurance coverage, they end up not being able to afford the care that they deserve, or they end up bankrupt because of the care that they were given. I think it was Erica who had mentioned that single payer would be like a giant GoFundMe for everyone. And it's funny that she brought that up, because we now live in a society where GoFundMe, right, the one that we all see the ads on, or we see it on our Facebook for our friends or family members, is one of the largest insurers of our nation, because people go broke so often from medical care, something that should be your right, right? This is our right to live, right? Our life, liberty, the pursuit of happiness, right? Remember that? That is our right. And sadly, people go bankrupt trying to pursue that life. And as a critical care physician, it pains me every single time I have to talk to family members and loved ones. And the first thing they ask me is, well, if I try to save my loved one's life, or if I keep him on that ventilator, or if we continue with the care, how will I be able to afford this? Is this covered? I've had patients who I've diagnosed with cancer who've told me, well, I don't know if my family's going to be afford to take care of me. And instead of getting the treatment that they deserve, to get that surgery or get that radiation therapy that Dr. Song can get them, they choose to not pursue treatment. That's the sad reality of the system that we have in place. And a lot of them don't understand what kind of coverage or not coverage they have, because it's that huge mess that Jenna showed us, or that Dr. Bill had showed us in that beautiful picture. That's the system that we're in now. And I think that it's great that we're all able now to get this better understanding of the healthcare system that we currently have and the potential that we can have in the future. So I just want to say from the bottom of my heart, thank you everyone who's educated me during this evening. Thank you for all the passionate voices that we see, and thank you for spreading that word. I'm here with a group of representing a group of just amazing individuals, the South Bay Power People Movement in Assembly District 66. We are strong proponents of healthcare for all, and we are so happy to be a part of this. I'm going to cut mine short because I know we're running a little late on time, and so thank you all again.
Thank you, Dr. Richard Nguyen. Now we're going to move to Assembly District 53, a representative for the slate running there. It's Lynn Stransky and Juan Portillo.
Hello, good evening all. Thank you guys for having, thank you all for having us on. My name is Juan Portillo. I'm a first generation Latinx Koreatown resident, speaking alongside my slate mate to represent the People's Slate of AD53. Our Assembly District, AD53, stretches from just each of Larchmont Village all the way through Boyle Heights and then south of Huntington Park and Vernon. It is extremely diverse in culture, art, and lifestyles, but also based on socioeconomic status. It includes neighborhoods with high density housing and poverty, as well as affluent neighborhoods like Hancock Park, where folks like Mayor Garcetti and Assemblymember Santiago reside, among other elected officials.
Hi, my name is Lynn Stransky, and I serve on the Wilshire Center Koreatown Neighborhood Council as a business rep on the Transportation and Public Safety and Economic Development Committees, as well as liaison to the LGBTQ+ Alliance. Our team includes local progressives and activists who are dedicated to working together for a better future for us all. I believe in Medicare for all because it is simply the kind, compassionate, and right thing to do. We must treat every life with equal dignity and respect, regardless of their financial ability. So I just wanted to talk a little bit about our slate mates. I guess first I'll talk about our mission. We want to stop Big Pharma from taking advantage of sick Americans by charging exorbitant prices for necessary, life-altering, and even life-saving medical treatment. Access to medical care should not be reserved as a privilege for an economic elite, and no one should die from rationing their insulin. No one here should spend the rest of their lives in debt because they survived cancer. And also, no one providing that medical care should need to start an OnlyFans account simply to make ends meet. I'm especially proud to be included on this slate alongside Sharon and Michael of K-Town for All, a group of organizers who work to serve the needs of our neighbors who are experiencing houselessness and who face displacement. Not only do they do things like distribute food and health and sanitation resources to our disadvantaged communities here in Koreatown, they also work to prevent displacement of our neighbors all over LA. Most recently, they encourage people to flood the mayor with demands to cease sweeps, which displace those without shelter in the name of alleged sanitation. Our slate also includes Christina Wong of Anti-Sewing Squad, an organization primarily consisting of women of color who have assembled and distributed PPE when our existing institutions have failed to adequately address the pandemic. We're also running alongside David Kim, who ran for Congress and who fights tirelessly to protect immigrants and our undocumented population.
Thank you all for providing profound education on healthcare and for your time and knowledge and wisdom. I think for myself, this kind of hit home in just a small way, coming from a low-income family where my father never purchased health insurance. It was just too much of a demand when raising 2 kids, and so he opted out of health insurance throughout his life, just so that income could go down to us. And so that's just a small story, and thank you all for sharing your personal stories on why we're fighting and unifying together as voices, as voters for Medicare for all.
Thanks, Juan and Lynn.
Thank you, Juan and Lynn. Now we're going to move to our last feature speaker, Jacinta Link.
Hello, my name is Jacinta Linka, and I apologize. I had intended to have something, I will fall woefully inadequate compared to everyone else. I found myself as a nurse getting COVID tested today after spiking a temperature of 103. I'm a 30-year registered nurse. I'm also an elected member of the LACDP, and I am here to sing the praises of the 41st AD. What an incredible group of people that are running. They are amazing. I encourage people to help them get out the vote. I want to bring attention to my patients. I first wanted to thank Dr. Paul. Dr. Paul Song. My partner thought that I sounded like I was at a revival listening to you. I was saying, yes, yes, screaming at the screen. Amazing, you said the truth. I want to talk about my patients, and I want to talk about patients that are underinsured or not insured. And this is such a huge problem. For the underinsured, the copays are so prohibitive that patients often don't seek help, just like the uninsured. And what happens is we see them in the hospital when they are often so gravely ill that the care we provide is absolutely catastrophic. And the results are often catastrophic too. You know, somebody said, one of the speakers, that this is state-sanctioned violence, and that is so true. Not everyone qualifies for Medi-Cal, and that's a very important thing to say here. Medi-Cal isn't a great insurance, as we heard from Jeannie, a very great talk she gave. But can you imagine when you don't qualify for Medi-Cal and you're an hourly wage earner? How can you possibly pay for insurance? And how can you even pay out of pocket? The real problem we have in this country is the cost of catastrophic care. And I absolutely believe that so many of the patients that I have helped deliver catastrophic care to, if they had had well care, they would have been fine. If we could have caught these things early, the gestational diabetic, the pregnancy-induced diabetic that needed insulin, the patient with cholestasis of pregnancy that was completely undiagnosed and comes in with a full-term dead baby that we have to induce out of them. This is the huge problem. Every healthcare provider I know carries devastating stories that will just forever haunt us. Horrible outcomes that with proper care would have been so different. I'm urging everybody, let's storm this beach together. I know that some of us may have different political views, but when we are for Medicare for all, we can work together and get this done. We have to do this. This is a crime against humanity. Thank you.
Thank you, Jacinta. And we're gonna move over to Assembly District 49 Representative Katie Chan.
Hello, everyone. My name is Katie, representing Assembly District 49, the San Gabriel Valley Bernie Card slate. And I'm so excited to be here with everyone. Just hearing everyone speak right now, it's just, I have a long way to go. I'm only 21. I'm currently a UCLA undergraduate student. And just, yeah, I just want to say a huge thank you to everyone who currently works in the healthcare industry, just everyone who has a job right now. And like, I feel you all, like personally for me, I'm so worried, like I'm gonna be like jobless right after I graduate, which I will be graduating in March. So that's very soon, but I will be studying full-time for the LSAT, so I have that going for me. So to share a little bit of my own personal story, growing up, I am blessed and privileged enough to be covered under my mom's health insurance. And I remember my mom like stressing out about health insurance when her company told her she'll be laid off when I was just only 8 years old. I was in 3rd grade at the time. And then she was so stressed, she was crying every night, because she was trying to find like basically like another job, you know, but luckily she was blessed enough to end her laid off job and immediately start working at her new job the following day, meaning like she had no breaks. Sorry, I'm getting really emotional. But yeah, it's just really stressful, you know, because healthcare should be the right. No one should be worried about this, especially like taking care of families and such like that. But yeah, I'm so glad to be running on with slate mates that are on the same mindset as myself, that Medicare for all is definitely needed. So yeah, I will just drop my links right now before I leave any more emotional thoughts out there. Thank you so much.
Thank you, Katie. I'm going to pass it over to Stephen Gibson. He is from Assembly. He's in AD41 People's Action Slate. And I just want to thank Stephen because he's been doing a really great job at keeping AD41 People's Action Slate very well organized, along with a whole bunch of people behind the scenes. So go ahead, Stephen.
Thank you, Elizabeth. Thanks, everybody. We'll have one more speaker, a representative from AD 66, People Over Profits, Timothy Byer. Please unmute yourself and give a presentation.
Thank you so much, Stephen. I'm a member, my name is Timothy Byer. I'm a member of People Over Profits. That's another progressive slate in AD 66. And we've got some great members on it, three people that were Bernie delegates. We've got a member of UTLA on our slate, and we got some local activists. And we are unbelievably unapologetic in fighting for things like Medicare for all. Now, connecting to Brandon's point about the Wilmington refinery, we share a common problem with MHF in our refinery as well in Torrance. And many of us on the slate have been fighting this issue, going to AQMD meetings for years. And yes, it's also a health issue. Further, several of us on the slate have been working with California nurses, organizing for SB 562. And so we are unapologetically for Medicare for all. So we want things like Medicare for all, housing for all, but all of this, and as far as relevant to this meeting, we just want to make sure that healthcare, housing, and which are tied to things like COVID-19, we don't want people, we want to make sure that in the time of COVID-19, people are housed to stop further transmitting this disease. And we want to just make sure everyone gets healthcare. Thank you very much.
Thank you, Timothy. And I want to thank everybody who participated today. We really appreciate you taking the time to share the concerns and the dream of doing this single payer healthcare here in California. So, you know, so many people here are with slates running for ADIMs, where we hope we can push the effort by getting in a leader of the California Democratic Party who will work for single payer, and by putting our energy into it. So I really want to respect people's time. We won't do questions now. Some of us will stay on later after the meeting's over if people have questions they want to share or follow up on. But I want to respect people's time. And in the meeting, let me talk about, I'm going to put my information in the chat. If anybody needs to follow up with me, we are holding another event another town hall next Saturday. It is for Black Lives, and will be featuring members from Black Lives Matter organizations and other organizations who can address this issue and talk about how we move forward, how we make a change, and how we reform and change the police so that more lives of young Black and Latinos are not taken away by police officers. So that's next Saturday's town hall. I put the link in the chat. Thank you so much for joining us today. And thank you for all the people who've been working behind the scenes, folks from AD41 People's Action Slate, Dennis Resendez, and Matthew, all the other people who've helped us with this event. And thank you all for joining. Thank the speakers who've been here and the people who are continuing this struggle. Let's get it done. Let's get single payer in California. Thank you. Thank you very much, everyone. Let's do this.
I see one hand raised. I don't know if that person wants to talk. I'm sorry, I don't see your name.
RG. Hi, I'm with the I'm also with the People Over Profit slate, and I just want to say I was at ADAMS before too. We fought for SB 562, and we really lobbied Al Marisucci hard for it. He didn't listen to us. And what better time than now, that in the middle of a pandemic, that we could use single payer for all. In Torrance, they're starting to treat patients in the gift shop of the hospitals. Okay, that's a damn shame. All right. Not only that, if ever, I'm sure everybody's looking on their social media, and you're losing more and more people to COVID. So, we did this. I mean, this isn't a new fight, but now we have to fight harder than ever to get single payer for all. Oh yeah, and I'm also a founding member of PANA. Vote for People Over Profits, because we're the ones that will fight for healthcare for all. We won't back down. We just talked to Ted Lieu's office. Told him that we need Medicare for all. We're trying to fight it on the federal and the state level as well. So if you have any questions, hit me up. People Over Profits.
Thank you. I see that Joanna has a question, and go ahead and ask your question, and let's see if people are still here that can answer it for you.
Cool, thank you. My name is Joanna. I organize with DSA LA and Streetwatch LA. We're grassroots volunteer-run org that work alongside our unhoused neighbors. We partner with groups like Homeless Healthcare and Community Health Project, and are often the sole providers of stuff like Narcan, PPE, to many unhoused communities across the county. I think, in terms of the conversation about loss of life recently, like we've seen the stats go from 3 unhoused folks dying every day to 4 this past year. And like, shout out to Kenneth for highlighting the wasteful spending around criminalization that comes with that. So I guess I'm just kind of curious if if there's a segment of this conversation in the single payer project that kind of centers in on harm reduction and opioid related overdoses, especially with the potential of incoming decriminalization stuff. I am like super invested in this. I'll paste a County of LA report that shows that this has been the leading cause of death among unhoused communities in LA for the last 3 years now. So yeah, it's a big one.
Joanna, you're muted.
Sorry, does anyone have any kind of insight on that, or just kind of?
We lost you for the last maybe 10 seconds of your question/statement, just so you know.
Yeah, I guess I was just wondering what, if there's any kind of segment within the single payer project that's specifically focusing in on overdose deaths and harm reduction and kind of substance use in the context of, potential decriminalization that could come to California in the near future, stuff like that.
May I take a stab? This is Jenny. Joanna, I work with a number of groups, and I don't see that many activists who are speaking on behalf of this problem. I mean, the crisis with opioids is real, and if you have a lot of information, I missed where you're coming from, but I would love to connect with you, and as much as we can, open up the space so this voice has more this community has more voice, it would be helpful. I really appreciate you speaking out and asking.
To add to that, what Jenny was saying too, it's kind of, I don't want to say that it's not been a focus. Of course, we're trying to, build the structure of the house, right? And within the structure of the house, mental health and substance abuse are in that house. But it's just that we're still outside banging on the frame, you know what I mean? But I agree with you, because I do know the decriminalization is out there, and we cannot decriminalize without providing the resource for people to have, like Portugal decriminalized it all, right? And that's a model to follow, but they also provided people with resources, mental health, substance abuse. Like, you get addicted, you just go check yourself in. Here, to get someone into detox is an act of God. I was working on it, I swear, this week. I think I spent about 3.5 hours on Thursday, or no, it was Wednesday, 3.5 hours dealing with behavioral health, trying to get someone to an outpatient or inpatient detox. In the meantime, watching the whole world, happen in Washington, D.C. So it's very much so needed. I think that the conversation will be there where we will be turning to activists like you who have that frontline experience to bring that in, so that when we're really starting to pull together the bill, I think mental health and substance abuse are kind of in that same house, and we will need strong activists to bring in that frontline point of view, because I don't think a lot of healthcare period has ever focused on it ever since Ronald Reagan stripped it away. Everybody looks at healthcare like you put it in the corner. We don't talk about that. I've lost family members to substance abuse and mental health. And so it's very close to me. My sister is very much so a problem, issue with mental health, and can't get under control, because when you have someone who has mental health or substance abuse issues and you tell them, I can't help you, you have to call your insurance. Really? Are they going to call? Is the person getting ready to commit suicide going to call their damn insurance to get a psychiatrist? No. But legally, I cannot say, okay, I'm going to set you up with this person, I'm going to get you admitted here, unless you are literally a harm to yourself or others. And even still, that's up to some psychiatrists to determine if you're really a harm to yourself. So I'm sorry to go off on that tangent. I'm with you, girl. It's frustrating as hell, but right now I know that it hasn't been like the forefront topic, just being 100% real, because we're trying to pass that legislation. But I do know that mental health is going to be in there, and if it's not strong enough, I'm going to make it strong enough, because after this pandemic, we're all a little fucked up, right? And after what I just watched in Washington, D.C., I had to go spend the whole damn morning in the forest because I'm a mess. So I just want to I had to spill that out, but I'm just being honest. Like, I can't tell you that, yes, there's been a whole big discussion around it and a whole big, section of the legislation, but I can tell you that it will be something that will be discussed as we get Gavin to get his shit together.
Thank you. Yeah, I really appreciate people's time, because I know everybody who's connected with ADIMS is under an incredible time pressure. So thanks so much for spending a couple of hours with us this Saturday on this issue. Any other final thoughts, or if you want to keep the chat, you know what to do. You pull down on the 3 dots and do save chat. Any other final questions or comments before we end it? All right. Well, thank you, everybody. Let's do this. Let's do everything we can and take care of ourselves, take care of each other, take care of yourself, and let's go in this for the long haul, because change doesn't happen quickly. Thank you. Thank you very much, everyone.
Thank you. This is so encouraging. Thank you.
Thank you.
Thanks, Stephen.
Thank you, Stephen.
Thank you, everyone that participated.
Yes.
Thank you, everyone.
Stephen and all the organizers.
Thank you, everyone.
Amazing.